Who there knows or listens to something from Bob Marley? He was primarily responsible for spreading reggae worldwide. He was the first great pop star that ascended from the third world, selling over 75 million albums. But his brilliant musical career was interrupted early. In 1977, Marley found that he had an injury on his right footing finger. Doing some medical examinations, the diagnosis was malignant melanoma, which is a type of skin cancer. At the time, doctors recommended amputation to mitigate the risk of the disease spread throughout the body, but Bob Marley refused the procedure because of his religious beliefs. As he was adept at Rastafari, he believed that the human body is a sacred temple and that no part should be amputated. In Miami, he even allowed the orthopedic surgeon, Dr. William Bacon, remove cancerous fabric, but that did not have the desired effect. So Marley went to Germany and, under the care of the controversial Dr. Joseph Eisels, underwent several questionable interventions to combat cancer. And just like the time before, expectations were not achieved and cancer soon spread to your brain, stomach and lungs. And on May 11, 1986, he died, young, at the age of 36. Was Bob Marley a religious fanatic who wanted to die? Should it be viewed as a suicide or an inconsequential? Of course. Certainly, like every human being, he tried what he can follow the instinct to survive. What he wanted was to receive medical treatment that respected his will, according to the values a euro he valued. Whose ownership of your body is? In fact, the physician, in the exercise of the profession, can come across patients who, for personal or religious reasons, refuse a therapy, a device or a certain procedure. Most of the time, when the patient refuses a certain therapy, it is not because he did not want to be treated, but because he wants to choose the therapeutic option he considers appropriate to what he believes. Even though he has no technical knowledge of a doctor, each person seeks to learn what it is possible to be done, what is in accordance with what he thinks is good, all by the way he sees life. In Brazil, the 1988 Constitution, in Article 5 in Items 6 and 7, says they guarantee to anyone three things. A. The right to refuse medical treatment. B. The patient's freedom to refuse the therapeutic proposal offered by the doctor, and C. The right to choose a therapeutic option that you consider convenient. In addition to it, there is the Civil Code, which in Article 15 determines that no one can be embarrassed to undergo medical treatment or surgical intervention that does not want. However, since the early 2020, a real war between those who defend and those who are against something that has always been done. We didn't even remember the name, but it became famous: early treatment. It is nothing more than initial treatment. As soon as possible it is possible to act on the first symptoms of a disease. It consists of a prescribed therapeutic scheme according to each clinical picture, through medical analysis that uses used drugs against other pathologies when there is nothing specific to the still unknown evil. This is called off-label treatment, or out of the leaflet. It is defined as a basis in successful observations that avoided complications and then hospitalization. This reuse of medicines to combat a new disease is common in medicine. In the 6th edition of Volume 72 of the journal Pharmacological Reports, from German publisher Springer, Indian researchers say that, in addition to being able to provide a quick response to relieve the patient's clinical picture and then to save lives, another advantage of this practice is a cost minor financial. The main allegation of early treatment detractors is that drugs without proof of effectiveness are used. Indeed, it is a valid and reasonable allegation, propagated by the traditional media and so many fierce fans of this opinion. However, the same media has already celebrated the possibility of people could use the drug for a disease that was neither specific nor had proven effectiveness against it. In June 2009, the World Health Organization stated that H1N1 swine flu was a pandemic. It spread through 70 countries and hit the 50 U.S. states. There, under the guidance of the entity, several countries began to acquire and prescribe an antiviral composed of oseltamivir phosphate, marketed in Brazil over the Tamiflu brand. Here, the Ministry of Health spent about 400 million reais to serve 14 million people. And in the same year, the recommendation was that it should be used within 48 hours after the start of H1N1 symptoms to reduce the viral load and avoid serious paintings of the disease. The federal government, on the opposite side of the political spectrum of 2020, distributed to the country throughout the basic health units. People were encouraged to flu signs. And to receive the medicine, the person underwent medical or private medical care. And if it was proven suspicious, the doctor prescribed the drug in the recipe. However, in 2009, there were no robust studies attesting to Tamiflu's effectiveness to combat H1N1. The only evidence was observational studies. Then, in 2014, in a report to the renowned Dr. Drauzio Varela, Dr. Nancy Cristina Junqueira Belay, who was coordinator of the Scientific Commission of Influenza and Clinical Virology of the Brazilian Society of Infectology, categorically admitted that no randomized and controlled studies were done to find the effects of Tamiflu, but through experience clinic. And in 2009, there was no excessive concern with official certification of any medicine that had undergone controlled randomized studies. But by 2020, thought changed. YouTubers, jurists, journalists and politicians began to give their opinion on health protocols, drugs and clinical management of patients. An intense conclamantation began by the scientific proof. The 2009 comparison with 2020 shows that people have been seeking to usurp functions that fit only to specialized health professionals, as well as showing an attempt to run over the patient's freedom to his own body. All this, even though the doctor is on the front line, dealing daily with various urgent clinical situations, he is the most suitable professional to deliberate the level of benefit of each treatment. From the libertarian point of view, philosopher and economist Hans Hermann Hoppe, in the introduction of Murray Rothbard's Ethics of Freedom, said, "Everyone owns their own body, as well as all the natural resources it puts in use through your body. He is the most vital and sacred. It is the first and most important property. Thus, it is not up to the state or other subjects to impose what we should do to take care of it." In Brazil, the courts recognize a so-called principle of autonomy. This means that the individual's ability to self-development must be respected. In this, there is no room for the traditional paternalistic medical care model, in which all definitions are decided in isolation by the doctor. According to this principle, it is up to the patient to accept, refuse or request medical intervention that considers it reliable. Also, no doctor should be coerced to follow protocols or determinations that are in disagreement with their conscience. All of these considerations are even assigned to the Code of Medical Ethics of the Federal Council of Medicine. But the curious thing is that we come to see true authoritarian intentions of some governments, politicians, jurists, celebrities, and YouTubers, all according to the premise that they speak in the name of saving lives, rather than taking care of the freedom to combat crises. They began to defend and stimulate restrictions, even wanting to dictate the way doctors and patients should relate. It is sad to see a clear attempt to master the most important of properties, our body.